Welcome back, everybody, to Home Health Chronicles, the good, the bad, and the ugly. I am here with Mai, and she's got a few stories to share. And I just do want to preface this with that this is not to promote fear and it's not for shock value. It's really just to help other clinicians recognize any warning signs, prepare for difficult situations, and hopefully prevent something similar from happening or just have a learning experience. So, Mai, thank you for joining me. I'm so glad that you're here and able to share your stories.
I am a physical therapist. I've been a physical therapist for 26 years. I've been in home health for three and a half.
Okay, so fairly new-ish, but not.
Not as long as as I've been a therapist. I just got into it recently. Yeah.
Yeah.
And I'm out here in Seattle. So
Okay, very
yeah,
nice. Are you like in the city or are you on kind of the
I'm in one of the suburbs. Yeah.
outskirts? Okay, yeah. My sister lived in Seattle for a while. Just they just moved to Spokane. Kind of get out of the city a little bit. But so why don't you tell me kind of what I think you were talking at earlier we were chatting about you having to call in a wellness visit on your patients. Why don't you kind of tell me what happened leading up to that visit and kind of what prompted it?
It was a routine visit. So I had seen the patient before, but the reason that she was on service is she had fallen down half a flight of stairs in the home and nobody found her for 24 hours. And so I had called the day before to schedule the appointment. So she knew I was coming. And when I got there, I knocked. No one answered. No one answered the door. Rang the bell. No one answered the door. So I called, and no one answered. And normally I'd be like, "Okay, I'm done. I'm just going to walk away." But because of why we were seeing her falling down the stairs, no one finding her, I kind of got a little bit freaked out. And so, I believe then I called her daughter and her daughter hadn't heard from her. And so I was like, okay. And then I called my manager and they said, it couldn't hurt to have the police come out and just do a wellness check. And so that's what I did and let them know who I was and everything, every background information. And when they got there, they did everything I had done, but they had gone to the window to look in and they could see her, but she was
Yeah.
fine. And what had ended up happening is she was asleep when I had called. But like I said, normally I wouldn't have done a wellness check. That wouldn't have been the first thing that popped in my head. But because of why we were seeing her, I thought, you know what, this is just better safe than sorry. Just call and have them come out. And I was glad that I did because I, uh, I eventually saw her, did all her vitals, and her vitals were a little bit abnormal. So I needed to call the doctor and let them know what was going on. So it ended up working out for the best that I had called. But there was just a gut feeling that I'm like, you know what, let's not ignore this patient. Do you know what I mean?
Yeah.
Not that I ignore patients, but
Yeah, 100%. I mean, anytime you get those kind of like that spidey sense, that tingling feeling, that thinking of, something just not right, especially when we call the night before, because I've had this happen to me as well. I've called my patient, they know I'm coming, and actually somebody I was calling on the way and I didn't hear from her. And I was like, I always hear from her. And you show up at the door, you don't hear, there's no answer. And I'm like, she knows I'm coming. She can't leave the house. So I know that she's there. Right. So what's going on? And that's when you start being kind of the creeper looking through the windows and saying, okay, let me just investigate this a little further rather than just kind of, okay, I'm just going to go home, because a lot of times our patients don't have somebody checking on them 24 hours a day or even every day. And this person ended up, I could see her through the window and she was in a locked apartment and there were people around, their water had gone out. And there were people around. It's like, I need somebody to let me in to this apartment. And they went and got the apartment manager. I ended up having to call 911 on her because she had an exacerbation of like diverticulitis and she was completely out. So 911 had to come and she was hospitalized. And I was thinking, if I didn't go and see this person, how long would it have been had she gotten some help? So it's definitely something where you kind of trust your gut. And, sometimes we have to be a little bit creepy. I think I've looked into many windows, but I'm like, I know that you should be here and you're expecting me.
I know you're in there somewhere, but where are you? Yeah.
Yes. Yes. And then you were telling me about a time where you felt the most unsafe recently in a
Yeah.
situation. So what
So
happened?
like I said, 3.5 years. I've only had one instance where I actually thought I was going to be physically harmed by a patient. And he had lived in an adult family home, developmental delay, bipolar, and he. I got there. I introduced myself. He was pleasant, no problems. He started telling me about the provider, the owner of the adult family home, and how he didn't care for her. And I was like, okay. And I took his vital signs, and one of them was a little out of whack. And so I called the adult family home provider first, to see if that was normal for him. And while I was on the phone with her, he said, "Who are you talking to?" And I told him, and he literally, on a dime, turned, jumped up out of his bed, and got right up into my face and started screaming at me. And I was like, thankfully, I had was standing, I was between him and the door, so he wasn't blocking my exit. But I thought, oh my, because you after a while you just get in the habit of, okay, where's the door? Where's the door? And so I was just happened to be standing there. And so I just backed right out of the room, and he's screaming at me to get out of his room. And I was backing out and trying to talk him down a little bit, and he just kept coming
Coming
after me.
at you.
Yeah. And
So
that
did
is, yeah, go
did
ahead.
you just leave?
No, I didn't. He doesn't leave his room for whatever reason. He just doesn't come out unless he goes to the bathroom. So I went into the front, where they have the kitchen table, and sat down and talked to the caregiver who was there. And she said she had only been there for 2 weeks, and she said she'd never seen him like that. And so I called the adult family home owner, and she says, yes, he gets like that, and it's pretty severe. And I'm
Yeah.
like, that would have been something nice that you had told us, that
Yes.
this could happen. And so, but I let her know. I mean, it was enough that I told them that at least for physical therapy, we're not coming back,
Yeah.
because you're telling, and because she's telling me that this happens often, and it occurs spur of the moment, so you never know, you can't read that it's coming. And I said, we're not going to come back. And I let the nurse know who was going, and my manager know, and we didn't go back because
Now
it was,
is the nurse still going to
no,
see this? No. Okay, so nobody's going back. Yeah.
nobody's going. Yeah.
That
Yeah.
and do you feel like you were supported by your manager in that decision?
Yes. Yes.
Yeah. I think
Yeah.
that's huge.
It
Because
is
a lot
huge.
of times I don't feel like some agencies do support clinicians this way when you say, look, we've been in an unsafe environment, we felt threatened, and it's like, well, what can we do so that you can still go back and see this person? And sometimes, maybe there is other things that you can do. You can have another person go, or you can make sure the door is always open, or different situations. But in this situation where you're only seeing this person in the room, have a history of turning on a dime and being potentially physical, what do we do in that situation? Was this the first time you had seen this patient that this happened?
This
Okay.
was the
Was there any indication in the chart, in the notes, that something
that
like,
he could be like this, nothing. And when I got there and was talking to his caregiver, like I said, she had never seen it, so she didn't give me a heads up or anything. It wasn't until it happened, and then I talked to the owner later, that she said, yes, this happens often. It's like, that really needs to be in the chart somewhere, that
yes,
this is
yeah.
happening,
Does
because
your agency do like a welcome call? And was it do you know if it was with this facility owner that it was done, or was it through the patient?
no, it would have been for him, it would have been through his power of attorney.
Okay.
And so if the power of attorney is a guardian, they're not really going to know, a
Right.
state appointed guardian, they're not going to know how he is daily. And we do do welcome calls, and there is a question regarding anger, aggression, violence. But again, if it's with the guardian, they're not necessarily going to know that. And we don't normally call the adult family homeowner for those questions. It's usually the patient or the power of attorney or spouse or something like that.
Yes. So now that this has happened to you, right, is there anything that you do differently after this fact, going into visits, or just kind of being more, not that you weren't aware of your surroundings because you were, but a big kind of theme, just talking to people and for yourself, is knowing your exits,
Yeah.
right? Knowing where your stuff is, how to get out. Even if you're in a situation like this and your bag is there and you feel that there's an immediate threat to you, of getting out of that situation.
Since then, I always, and that's something that they in orientation that they mention, make sure that there's nothing between you and the exit. But now I really make sure there's nothing between me and the exit. And even my bag, I make sure that it's not in my way for whatever, that if I need to make a quick exit, I'm not tripping over my bag. So I
Yes.
always am very mindful of where I'm placing all of my stuff,
Yes.
just in case I need to get out quickly.
Yes. Yeah, because I feel like we get so comfortable doing this on the day to day that you kind of lose sight of that. So, what I want to accomplish with just having people being able to tell their stories is to kind of get that back in your mind of
Mhm.
being safe out there. So, I really appreciate you coming on and sharing your stories, because it
Thank you.
just, even if it can help, one person, I think that makes a huge difference.
I think it does. Yes. Thank you so much for having me.
Yeah, thank you so much. And if there was one thing you would want someone to kind of take away from either experience that was listening, what would it be?
It really trust your gut for both instances, that because part of me in the second instance wanted to try and calm him down and stay in the moment and try and, but in the back of my head I'm like, I really need to exit. I really need to get out of here. So yeah, it's just to trust your instincts that, if something's not right, most likely it's not right. So
Yes,
yeah.
100%. I agree. All right. Well, thank you so much for sharing with us. And if you ever have anything, hopefully you don't have anything else to happen, but we're always here for stories and
Thank
hopefully
you.
somebody can relate. All right. Bye, everybody.
Bye.